we're going to talk about how to enter a new person or patient into the software. Now, person and patient can be two different things. A person may be someone entered in your system as just a policy holder, a responsible party, and not necessarily a patient. They could be the policy holder for a patient that is coming to. So they are actually two different things. But in order to enter a new person and or patient, you could simply go to the person icon down to the bottom and hit new. So you'll see the new person window here. A lot of this is quite self-explanatory, but you'll go ahead first and enter in your patient information. If there's a middle initial, you can enter that. Preferred name, if it's a name that they typically go by, and then you have the salutation. So some people use this salutation, for instance, if they have someone who really wants to go by the salutation. So if we have Dexter Blaney here, who is a doctor, and he gets offended if we don't address him as Dr. Blaney, we really want to make it a point to kind of have that information in there. Some people want to be called Mrs. or Mr. So you can use that to that effect if you'd like, and just enter in that information here if you know that patient prefers to be called that. Otherwise, you can just enter it in however you'd like. We have three options here: patient, policyholder, and responsible party, like I mentioned before. This person can be 1, 2, 3, all of these, or just the patient, just the policyholder, what have you. So that's something we want to keep in mind. Sometimes if we have a family coming in and we're entering in a minor, that minor is going to have probably, one of the parents as a policyholder, maybe the same parent as a responsible party, maybe not. For instance, if we have a divorced family and we have the teenager coming in and the mother, holds the policy, but the child lives with the father and the father's a responsible party because that's where the bills go. In that case, the first person you want to enter into the system would be the policyholder, because once you do that, you can link that policyholder to this person here. Once you enter the policyholder, you would then want to enter in the responsible party, because then you could enter in, you could link the responsible party to this patient, and then last you would enter in the actual patient. So we'll go through how that would play out. Let's just say Dexter is going to be a patient and Dexter is his own policyholder. Now it's going to double check and ask you, would you like to assign this patient to be the policyholder for primary insurance? I'll go ahead and hit yes. So what it does is automatically checks over here that he has primary insurance because you made him a policyholder. And what it's saying is he is his own policyholder. The relationship to him is himself. We can also place him as his own responsible party. So now what we're going to do, we're going to go and enter his address. And city, I'm just tabbing through here. Phone number, cellular phone. So if you want to enable text messaging or text reminders, we want to make sure we get a cell phone. You have your sex, marital status if you'd like, and birth date. So you can either click the calendar or you can just type it in. And then we could do a social number. Now the Social Security number, a nice feature within the software is once you enter that and move on to the next field, it's going to star out the first 6 letters for privacy concerns and security purposes. So if you need to view that number, once you click in there, again, it'll go ahead and display it. But as soon as you click out, it will star those first 6 digits again. The chart ID doesn't have to be filled in. You could kind of use it for, whatever purpose you'd like. Your driver's license number. It's always a good idea to get the driver's license number and a copy of the driver's license just in case we have any fraud occurrences. The email, we'll want to do email, of course, because nowadays we're really doing a lot of emailing, email reminders, emailing campaigns if you're using any of our partners such as RevenueWell or Solution Reach, what have you. If you are doing some email correspondence or text messaging, you'll want to make sure you check these boxes. So now we're going to go ahead and we're going to assign and attach insurance to this patient. Eaglesoft attaches insurance through the employer. So in order to find the employer or create a new employer, you would just click on this hyperlink here, and it will go ahead and take you to your employer screen. Now, if you don't have any set up, if you're a new office, you're going to have to go ahead and create these. If this is a patient who, works at an employer that's already in here, that's great. We can attach them. We do know that some employers offer different plans. So if Abbott Laboratories here has different levels of benefits, we would want to go ahead and create multiple employers and just kind of note that within the title so it's easier for you to see. And there's a couple different ways you can do that. You can call it just as Abbott Laboratories. Let's just look at this. I'll go ahead and edit that here. So if we take a look at this plan, we can see that we have a $50 deductible, a $1,000 maximum, and then we have our percentages down here. So this could perhaps be, the plan A or, tier 1 or what have you. Some offices would put in the name maybe 50/1000. Just so they know that that's the plan with the $50 deductible and the $1,000 maximum. That way it's easier for you to identify, which plan needs to be attached to this particular patient. So if we look at the tier 2, this is a $25 deductible and a $1,500 maximum. So we could go ahead and place that in the title. It's just easier that way because we know there's multiple plans and sometimes there's different plans with the same group number. So that's definitely a way to do that. But say Dexter's employer is not listed here. So we're going to go ahead and create a new employer. And let's just say he works for Starbucks. Okay, the address isn't so important in the employer name. You'd want to go ahead and fill out the group number. And then the deductible, of course, is important. So we can put this as a $50 deductible and $1,000 maximum. I'll go ahead and put that in my title. The beginning month. So when does this plan reset? Not all will reset in January. You have some school systems and some unions that reset in the summer months. So you want to make sure that you place the correct beginning month in here. And then this is where you'll go ahead and you'll select the insurance company that's providing that plan. So for instance, let's just say it's Aetna. We'll take a look at that screen. Very important, you want to put in the name, the correct address. Now it's important when you're entering insurance companies that you enter it, kind of all uniformly. If you're going to enter P period O period box 555, you always want to enter that the same way for everything. If for some reason you make a mistake and you don't realize you have this insurance company in the software and you create a new one, but for the new one, you just call it PO box with no periods, it's going to create a duplicate insurance company. And that happens all too often, and it really kind of just makes a mess of that insurance list. So it's important, if you're going to use all caps in everything. If you're going to use the periods, just make sure it's all written the same way. Just decide on one way and stick with it. I get so many calls from offices that really need help cleaning up their insurance company list. So try as hard as you can to go ahead and do that right the first time. The phone numbers, of course, and then if you're going to use electronic claims, they'll have you put a claim payer ID here. If you're going to use attachments, electronic attachments, our services, they'll also have you put a claim payer or a payer ID here as well. And then what kind of payment source is this? Well, this is a commercial insurance company. So that's how you're going to make sure that all the information is correct within your insurance company. And then we'll hit use. And that has attached to this employer here. And you want to make sure you have the correct insurance claim in there. And then if there's any fee schedules that you get from this insurance plan, you can enter those in here. Once you enter the fee schedules, your estimations will be based off of the fee schedule. Otherwise, they're just going to be based off of the percentages here that you enter in when you review that plan. So you're going to want to enter in the correct percentages, and if the deductible applies. You can also enter coverage books as well for exceptions to the fee schedule. And then the adjustment type. So you can get real detailed and create an adjustment type, not just insurance adjustment, but you could call this Aetna adjustment, Aetna insurance adjustment, just so when you run your reports. So we could go ahead and put new here and call this Aetna insurance or just Aetna adjustment. And then you want to determine, if you create a new adjustment, where do you want that kind of coming off of? Where do you want to see that adjustment? In what kind of report? Do you just want that as an adjustment report? Or do you want that affecting your production report? You can also have it affect a collections report. Typically collections, we only have refunds affect the collections. But some offices will go either with the adjustment report or the production report. It just depends what they want to see that adjustment come off of. Okay. When you look at your employer preferences here, this is what's telling you that you're going to identify that patient by a policyholder member ID. We do encourage that. More and more plans are identifying by this. If your plan does identify by the social number, you can still enter the social number in that policyholder member ID field. And this is where your calculation methods come into play. So are you estimating insurance for this plan? Is the insurance company responsible for all, or is the patient responsible for all? So you can kind of pick what you're going to calculate here. I think most do the estimate insurance that are in network. And then if you're having a secondary insurance, how do you want that to calculate? When we're looking over here, typically we ID the dentist by national provider ID. That's pretty common there. or if for some reason, you have special, if it's a Medicaid plan or something like that. And then we want to look down here. So this check mark would mean that you're authorizing the insurance company to send a check to your office, okay? Um, if this is a plan or a company that you have insurance responsible for all or patient responsible for all, and that patient pays you the entire fee and the patient gets sent the check, then you could uncheck this. And then you could check mark do not track claim. So if you're not tracking the claim because you're really not, you got paid, the patient now has the responsibility to kind of track their payment, then you could check mark that as well. We always recommend you bill your standard fee on any insurance claim, even if you're using a fee schedule. Just because you bill the standard fee doesn't mean that's what you're getting paid, but it does allow for insurance companies to kind of see what offices are charging in the area. So maybe they can kind of up their allowances during any kind of review. Notes. So if there's any notes you want to add to this employer, a lot of offices will add frequency information in here, that they're, frequency for radiographs is their benefits allow for bite wings, once a year, a full mouth or a pan every 5 years, cleanings once every 6 months or twice a year. You can put that information in here so you have that. And there is a spot for the clinical team to look in the chart and see that information so that they don't always have to come up and ask you. So we'll go ahead and hit use. Now we have that employer and those specific benefits attached to that patient. If they have secondary insurance, you're basically just going to do the same thing. You'll go ahead and attach that secondary plan. We do have the option to submit supplemental insurance. That cannot be done electronically, however, that has to be mailed in. And there are most offices I would say would use this as like a medical insurance submission. So you can enter that information in there. This box up here is called the recall box. You can put any kind of notes in here you want. Maybe this patient is going to alternate with perio, or maybe this is a denture patient. Maybe this patient's interested in whitening. So you can put multiple things in here. This box here shows you when their next recall is due. This is yellow because this patient has not had a recall here yet. If we had any appointments scheduled, the next preventive would be listed here, and the next regular with the doctor would be listed here. This you're going to go ahead and check mark when they complete and sign their HIPAA authorizations here and their privacy practices. If we attach any other patients to this account, they're going to go ahead and show up here. So we'll go through that as well. When we look on this right-hand side, we see the patient registration. So this is where they're going to fill out, all their demographical information here. So if you're not using Eaglesoft's fast check-in, you can go ahead and print the forms out. Now you have a couple options. We don't know, we don't have to print these out any longer. We do have some of our partners we work with that offer online forms such as RevenueWell, where your patient can, you can email them a link to fill out all the new patient forms. You can have a link on your website. You can even text them a link and they can have this all filled out online and synced right into their chart before they even come into the office. Or you can use, like I said, Eaglesoft's fast check-in, where you can use a kiosk in the office or a tablet or a laptop, and the patient can fill that all out electronically when they arrive, and it'll sync right into the patient's chart. So you don't necessarily have to print things out anymore, which is a very nice feature. The preferences, we'll talk about that. This is where you're going to go ahead and enter the primary member ID here for the insurance. If this patient has any appointment time preferences, you can enter that here. If they tell you they are always available on short notice, they have a very flexible schedule, you can check mark this. This will tally any failed, canceled, or neither appointments. Our neither is going to be that maybe we had to cancel them for a seminar, or maybe there was a big blizzard or a pandemic, for instance. Failed, we know they just didn't show up. Canceled appointments, I consider they gave you some notice. If they need a pre-med, you can check this box. And if you have your prescriptions and your drugs set up, you can go ahead and attach a prescription template for them. So if they're a pre-med amoxicillin, or if they need Valium, you can pick which pre-med they are. If they're an ortho patient, you can go ahead and enter information in here, how many months of treatment, when treatment is started, and how often you're going to bill. Up here under financial preferences, if you want to attach a discount to this patient, if you attach like a senior discount, 10%, it's going to go ahead and give that discount to every service you walk out. Some offices prefer just to do an adjustment. This fee schedule here, this is not where you're going to attach any employer fee schedule. This would be if the patient did not have insurance and maybe you had an office in-house membership plan, you could attach that fee schedule there. Or if you had a special friends and family fee schedule plan, you could attach that there. This fee schedule overrides any employer fee schedule. So it's important to really pay attention if you're going to use this here. Preferred dentist, if you have more than one dentist in the office, I would make sure that you have the patient's preferred hygienist picked here, or preferred dentist. That way when you go to schedule treatment, it will default to that dentist. You can attach a pharmacy. So you can ask the patient what their pharmacy is, and if you have that in the system, you can attach it. If it's not in the system, you can go ahead and click on that hyperlink and you can add it. That way, if you're prescribing for the patient, you can go ahead and have that pharmacy print out on the template, or you can, if you're calling in prescriptions, you can just look it up right then and there and get the phone number. Preferred hygienist, I think, is also important. If you have more than one hygienist, I would select that particular hygienist, and then I would make sure the recall frequency is correct. That way, when you run your Recall Wizard report, you're going to get accurate information. So if this is a 3-month recall frequency, I would make sure your hygienist is keeping up on that. And then this is checking if they're to receive recalls or not. So there's some new patients you get who don't live in town, who may be visiting a family member. Perhaps they're coming in for an emergency appointment. You probably don't want to send recalls to that patient. And then this is just a summary of their year-to-date charges, collections, and visits when they were entered into the system, their first visit. So there's some good information in that patient preferences screen. This is for Medicaid, right? So if you're having to do any kind of Medicaid and you need an ID number here, and then if there's, school information necessary, you can enter that in there as well. The history button here is going to show you anything that you've ever walked out on the patient, any service. Alerts, if you need to tie a patient alert to the patient, you can go ahead and just select it and hit add. The memo is a nice little tool that is designed for you to go ahead and put in little tidbits of personal information about the patient. So if the patient's getting married or, going on vacation, got a new job, you could go ahead and enter that in there. You would want to date any time-sensitive information, as it doesn't do that for you. And this memo can be deleted. Once it's deleted, it's completely gone from the system, so patients don't have access to this like they do when they want to get their chart records. They can get their their chart notes and their x-rays and such, but this is not accessible to the patient. And like I said, once it's deleted, it's gone. Some offices will use this when they get a new patient phone call, and maybe it's a new employer and they can't enter that all in at that particular moment. They'll just jot down, some quick insurance notes so that they can go back in and enter that in the system later. This is accessible too from different areas in the software. There's an icon on the schedule. The clinical team has access to that from the chart as well. The prompts is something you can add to the patient registration. So if you want, some extra information on that registration, you would set that up in the front office under lists and prompts, and you could create the prompts from there. Letter, if you want to send a letter to the patient, you can do that from here. The missing tooth, really, if you're not using the clinical module, you can use this to chart any missing teeth. You can track referrals. So if the patient's being referred in, you could track who's referring them in. So is it from another patient? If so, you can go ahead and find them on the patient list. If it's a provider, so someone that works within your office or company, you can mark that. Or if it's a different referral source, like maybe another doctor or a Google or Facebook ad or something like that, you can track that. So anything in Eaglesoft that has it's blue and it's underlined, it's a hyperlink. If you click on that, it's going to go ahead and take you to that list. So for instance, if this patient was referred by a referral source that you don't already have in the system, you could click on that and it will take you to the list, or at least it should. And then you could go ahead and enter in that new referral source. Not sure why that's not working right now. Let's not exit. Let's go ahead and just hit OK, because I want to go to just had a little error there. Let's go back into the referrals. And if we click referral source, there we go. So if you have a new referral source that isn't on the list, you can hit new and you could go ahead and enter that information there. You can also track if you're referring out as well. So if you're going to refer out maybe to an oral surgeon, you could hit new. You could pick your oral surgeon and you could write a note, maybe extraction, third molars. So you can go ahead and keep track of where you're referring out to. And there are reports for all of this information as well. If you're printing a label or an envelope, maybe you're going to send a letter and you want to mail that, you can do that here. Prescription history, so any prescriptions you've ever issued to this patient. And then you have your medical history. You can also customize medical histories within Eaglesoft as well. This will take you right to the account. This will take you to the patient's Smart Doc. So the Smart Doc is the electronic chart or electronic filing cabinet. Every single patient has their own. The practice has its own. And every team member has their own Smart Doc. So if there's any letters from specialists that you want to scan into their record, you can do that through that Smart Doc. And then Care Credit. So we also integrate with Care Credit if you're going to use Care Credit for payments. So that's the patient window. So once you enter them in and you go back into person, you can hit last person here. And then I'm going to double click. And there's that alert we attached. And then now this is forever known as the edit patient screen. So we have all that information in there. So now let's add another family member to Dexter's account. So let's hit new. All right. And then we'll go ahead and add. These are names of my animals, by the way. So we'll go ahead here and we're just going to mark Teddy as the patient. Okay. But once we get here, we are going to mark that Teddy has primary insurance. Now we can go ahead and click this and we can pick our policyholder. So I'll go ahead and select Dexter Blaney because he is the policyholder. And it goes ahead and it links that all of that employer and insurance information to this patient. Same thing. So let's just say Teddy's a minor and the responsible party, he's not the responsible party. Actually, the responsible party will be his father, Dexter. So we'll click on that responsible party. And we'll go ahead and use, and it's going to go ahead and bring in the address, phone number, so that you don't have to type that all in again. Okay, if we have phone numbers here, any extra phone numbers, we can do that. We'll go ahead and put a birth date in here. And social number. Now I would probably have the email address as the parent's address, unless Teddy does have an email, but you know, with a minor, I would use the parent's email address. And then the same thing over here. So as a new patient, now this is all going to be filled out for him. So we'll go ahead and hit OK. And then when we go ahead and take a look at Dexter's account, just double click. Now when we look down here under family members, we'll see that Teddy is listed. If we right click, we can switch to, and then it'll bring him up here. Okay. So that's how to enter in a new patient, enter a new employer and insurance, and attach it to the patient's record.